Good morning, everybody. Today I will be answering some of the most frequently asked questions regarding St. Hildegard medicine and the online appointments that I give. The first question is, what is St. Hildegard medicine? First of all, St. Hildegard of Bingen was a 12th century Benedictine nun to whom God revealed the causes and remedies for illness through mystical locutions and visions. This medicine seeks to find the physical and spiritual causes of illness in each individual, and it proposes a variety of techniques such as natural remedies, prayer, fasting, physical activity, and detoxification methods, among others, to boost your natural responses to fight against disease. What can I expect of St. Hildegard medicine and the online appointments that I give? First of all, you need to fill out a form with your medical history and send it to me at least 48 hours before the appointment so I can have enough time to go through your medical history and start thinking about potential causes for your health problems. During the appointment, I'll ask you questions and discuss all aspects of your life, such as nutrition, physical activity, spirituality. And depending on the program that you pay, I will give you some suggestions on how to improve your lifestyle in general. During the appointment, I will be also explaining some of the best eating habits that are most appropriate for your case, and together we will design a protocol based on your needs and budget. I will ask you how much time and money you have to invest in this project. So, what are the diseases that can be treated with St. Hildegard medicine? St. Hildegard medicine includes nutritional protocols, remedies, stress management, and other treatments that will help you with any health problem that you may have. However, it should be emphasized that there are emergency situations such as, for example, a ruptured gallbladder due to gallstones, appendicitis, or an accident. Those situations require immediate assistance, and you must go to the ER. Are the protocols of St. Hildegard medicine compatible with the medications of academic medicine? Yes, mostly. However, there are some specific medicines that should not be taken in parallel with some natural remedies. And this is exactly my job to tell you which remedies are best for your case, depending on your problem and the medications that you are taking. If I am under any medical treatment, can I stop it and be treated with St. Hildegard remedies? It is not really recommended. Only the physician who prescribes a certain medication has the authority to tell you when to stop taking it. For example, if you are taking antidepressants, those medicines are very dangerous if you don't follow the instructions on how to take them. And if you stop taking them all of a sudden, you can have serious effects. So only the physician who has prescribed certain medicines has the power to tell you when to stop and how to stop it. However, with St. Hildegard medicine, the overall health improves. So I have had cases in which people improve even in other areas that were not the cause of the consultation, and eventually the physicians take the decision to stop certain medicine. So what is needed for St. Hildegard medicine to be successful? At least in my experience, I consider that 3 things are very necessary. The first one is discipline. It is essential for the patient to have the discipline to start and to finish the treatments. It's also important for them to know how to follow instructions and carefully write down when they start and finish the treatments. Um, Not because you are taking natural remedies, they won't give you side effects. They will give you side effects if you don't follow the instructions on how to take them. This is really important. This is why it's really important to take notes when you started and when you should be finishing, to not overdo the treatment because that can have serious consequences. Faith. Faith is essential because if you don't believe that this medicine is going to help you, it won't. It won't help you. Even for the academic medicine, you need to trust the doctor. You need to trust in the medications in order for them to work. Investment. So you definitely need to invest time and money. I expect you to take the time to read the information that I'll give you, and to read also the recipes on how to prepare the treatments. You will be surprised to know that some patients don't really take the time to read the documents that I give, and sometimes they prepare the remedies the wrong way. Um, but I want to tell you that I will adapt in terms of your budget. I will adapt to your budget, and I will try to find the things that best fit for your needs and your budget. So next, why are there some people who follow a treatment and do not get better? I can recognize at least four different causes. The first one and the most common one is failure to follow instructions. Um, Most of the people who don't get better is because they don't have this discipline to follow the instructions. They do it their way. And for example, if you're supposed to take a treatment for a month every day, some like 3 times every day, some people do one time today, tomorrow they do 3 times, and then they forget to do it one day, and definitely it's not going to work that way. So you need to stick on the instructions. If it's 1 month every day, you need to do it that way. um, the other reason is the treatment is not appropriate, and this happens when, for example, if you buy a book on the remedies of St. Hildegard, and you try to pick one of the remedies that is there. Usually, St. Hildegard describes at least 3 to 4 different remedies for a specific condition, and it requires some discernment, some experience to figure out what combination of remedies are the best for your case. So sometimes people who don't have experience, they will just pick one, and it might not be the best option for your case. Incomplete protocol, and this happens also for the people who are um, taking care of their health independently. They don't take in consideration the spiritual aspect, the physical activity, and the nutrition. They think that just by taking one remedy that is listed, for example, um, to help your liver in case of a liver disease, they think that they will get cured with that remedy, and it's not that way. Um, the lack of perseverance. Some conditions improve quickly, whereas others require some time, even years of treatment. I have had cases of people who are very perseverant, and I have a case, for example, is one of my best patients. I have seen her for more than a year, and she uh, she saw me for the first time for a specific problem, and then a year later, with all the different protocols that I have given to her, other situations that were not the focus of the treatments were resolved, and even the physician took the decision to stop some of those medicines that that person was taking for these other problems. So definitely perseverance is very important. So thank you so much for listening to this presentation. And if you like it, please click on like And share this video if you think that somebody that you know might be benefited from this information. um, I wish you have a very wonderful day and see you next time.